Well, welcome everyone. My name's Laura Dixon. I'm going to be your presenter for today. We're covering over the next 5 sessions the entire manual for the acute hospitals. And when I'm saying acute, that's those hospitals that are not critical access hospitals, long-term care hospitals. And it's the entire section. I've broken it out into manageable parts. And so what we're going to talk about today, it's on slide number 1, quite a bit of information. We're going to start right at the beginning. What does CMS do before they even show up at your hospital? We're going to cover a couple survey memos that did affect hospitals. And of course, then we're going to start getting into some of the meat of it. During this time, I'm also going to address issues that, again, will impact care and some of the other conditions of participation, some of the other items that hospitals have to meet. And of course, any hospital that accepts Medicare, Medicaid payments have to meet all of these conditions for each and every patient. It does not matter if it's a Medicare, Medicaid patient or a private pay patient. They have to meet each and every one of them. So let's go ahead and start with the manual. And overall, why in the world are we here? Well, for a very good reason. Start everything up by subscribing to the Federal Register. This will send you emails when there is an update on something over which Health and Human Services in particular has purview. Certain important changes came down a couple years ago as far as it had to do with the manual. There was also what's called the Hospital Improvement Rule. And actually there were 2 rules that came out at the same time, same day, went into effect the same day. Hospital Improvement Rule and the Discharge Planning Rule. I mentioned that CMS, when they come back and they do their deficiencies, well, they come back and collect all that information and upload it into their system. Well, I briefly touched on a couple memos previously, so we're going to go through these. These that are highlighted, those are the ones I'm talking about. CMS and Joint Commission are very, very concerned about a safe environment so patients aren't hanging themselves, they're not strangulating themselves, or others for that matter. It focuses on the care and safety of behavioral health patients and staff. As far as texting, we're all doing it. We've been doing it for probably a few years, if not more than a few. There was one on Legionellas. Now, for those of you who probably have a little more experience, been around a few more years, you may recall when Legionellas was first identified back, I believe it was in the 80s. And what they found was this was growing, the bacterium that causes the Pontiac fever, pneumonia, very bad pneumonia too. As far as insulin pens, the memo that came out on that was a warning. It also talked about 4 breaches in infection control. Other memo on safe injection practices, that was another one. I mentioned the ISMP a little bit ago. I want to talk about their IV push guidelines. These are the top 10 errors from 2020. So let's switch over to some information you can use in your hospital. And that is the 3 worksheets. There are 3 of them. Discharge planning, by the way, that's 49 pages long. Infection control, QATI, quality assurance, performance improvement. You may go that by PI, however you wish to use it. What about vaccine storage? That's been a hot topic over the past year or so, in particular, of course, with COVID. How do we keep them? How do we store them? Now, we're still on some of these memos that CMS had put out and how they apply to hospitals. Discrimination, interpreters, Section 1557, huge impact on hospitals. Let's go ahead and start with the hospital manual condition of participation. As I mentioned, it is mandatory compliance. Now, as far as the interpretive guidelines, you'll find them in here. CMS has required education, and there are multiple key areas also. Now, the board, I'm going to call it the board. It's the governing body. Medical staff, hospital, they can more fully utilize other practitioners. Telemedicine, oh boy, has that taken on a new life with pandemic. The CEO, they're going to talk to them. The board has to appoint a CEO who's responsible to run the hospital. They have to manage it to make sure things are occurring. The board has to make sure every patient is under the care of a physician. That can include dentist, podiatrist, chiropractor. They must be licensed and a member of the medical staff. Contracted services, because not everything's done by employees. A great deal is done by contracts. They're responsible for those services that are provided, whether it is by employees or through a contract. I'm going to talk about emergency services. I'm not talking EMTALA. That is a separate condition. That's an Appendix V. And so with just some of the basic emergency services, by the way, CMS has a lot of policy requirements. Well, I want to talk now about medical records and patients' rights and access. Well, let's switch over now to medical records. The records have to be done promptly, completed promptly within 30 days. What goes into a record? Well, pretty much everything on a patient. Verbal orders, standing orders. Now, what if you have a set of orders? It gives you an option. Other requirements, other examples of menus, 1135 waivers. This is on medical records. CMS did make some changes. I'm going to switch over now to inpatient history and physicals. Informed consent is in 3 sections: patient rights, medical records, and surgical services. The minimum elements of any informed consent. This is what's mandatory. Now, there are optional elements that you can do. Again, you're not required, but you can. Record, as we mentioned, must contain orders, notes, reports, medication, diagnostic tests, and even vital signs. Discharge summary. Every record has to have a discharge summary. Every record has to have a final diagnosis. Why were they there? They have to be completed within 30 days. New standard, interoperability. This went into effect in 2021. If you have an electronic record system, it has to show that it can notify, it has notification capability, also known as information blocking. The definition of that is unless it is required by law or meets an exception. So there are 3 exceptions to when you can do that. First one, preventing harm. There's also the privacy exception. That's the second one. You have harm and then you have privacy. And then of course the security exception. And then there's a 4th exception. Responding to requests, we still have to do that. A couple other important sections. So that brings us to the end of the content. What I want to do now is give you kind of suggestion here or a situation. Thank you again, everyone, for attending. We appreciate it. And stay safe. Thank you.